Hello, everybody. As we all know that we are giving the class of certificate course of palliative care. It is a 12-week course under the SWAM portal. And in the earlier lectures, I have talked about hypercalcemia, and then I have talked about detoxification method of Panchakarma. Under the Panchakarma lecture, I told you that it very significantly affects your GIT. And now I'm going to talk how GIT health is important to your body and how it is managed. One of the very important factors is the microbiome. I'm going to talk on that part in this class. So you can see the hypercalcemia, Panchakarma, and gut health. All the three things are linked together with your patient. When you are designing the palliative care, depending on the condition of the patient, depending on the need, you can keep all these things in your mind and then how to proceed forward. And as you know that you have a multi-dimensional method of management, so you are having many stakeholders in your team. There is a dietitian, there is an Ayurvedic doctor, there is a medical doctor, and there are super specialists of different diseases which is affecting your patient. And nurses, volunteers, and the family members, they are also important part of your care. With this background, I start the talk of non-communicable diseases and gut health. Because most of the palliative patients are chronically ill. They are the non-communicable diseases, like they are having a stroke, heart disease, hyperlipidemia, cancer. They are all considered under NCDs, renal failure, stroke. So how the gut health is affecting these NCDs and how we can manage. This is the objective of this talk. So NCD and gut health, microbiome. Mainly I am going to focus on microbiome. So NCD includes diabetes, cardiovascular diseases, cancer, obesity, and neurological disorders, and many more. And the major risk factor is the poor diet, stress, sedentary lifestyle, gut microbiome imbalance. So there are many things which we have already discussed or which we will discuss in different lectures. Today I am going to focus on the gut microbiome. Okay. Before that, I want to define what is non-communicable disease. NCDs are significant global threat. In India, about 64% of the diseases are NCDs now. Factors increasing longevity, unhealthy diet, and sedentary lifestyle. Sedentary lifestyle, people are not very active. They are more on computer work. Sedentary lifestyle means not physically active, but always mentally active. And unhealthy diet, because of the time shortage and because of the letharginess, and they are always dependent on the market food. So unhealthy diet, because the deep fried diet or the frozen diet or heavy salted diet or the diet with the high preservative are not good for your health. And since you are not willing to cook fresh food, so you are dependent on the frozen food. This is also a very important cause of non-communicable disease. And third is the increasing longevity. Because of the medical interventions, we are living longer, but with disease. So that is the main problem that NCDs have been. The common NCDs I have told you in the earlier slide: cancer, there's oral cancer, breast cancer, cervical cancer, any type of cancer, diabetes, hypertension, cardiovascular diseases, stroke. And early diagnosis and prevention measures the comeback of NCD. Early diagnosis of the NCD. Suppose we are having blood pressure, and blood pressure has the complication of stroke. But if you can identify the patient with hypertension and you advise him to start medication and change lifestyle, at least he will be conscious what to do and what not to do. That's how NCD can be prevented. Blood pressure also a non-communicable disease, and stroke is definitely non-communicable disease. But stroke is the outcome of the uncontrolled hypertension. So hypertension is very slow, silent killer of your body. You have to be very careful. This is an example I told you. So early diagnosis is very important. Okay, prevention is better than cure. And this is dependent on early diagnosis. Accurate diagnosis in the early stage. You know, in the Ayurveda, they say there are 6 stages of disease. 3 stages are hidden and 3 stages are manifested. Shad Kriyakal. Shad Kriyakal means 6 stages. But first 3 stages, which are not manifested as a symptom, but it is manifested as the imbalance, physiological imbalance. So if a Vaidya is there, or if a patient can identify the physical imbalance, and then he can start rectifying that imbalance because of the food, habit, and lifestyle changes, he can stop the disease. Early diagnosis is very important. Population-based intervention and promoting physical activity are necessary for this. So this is a cartoon I have made, non-communicable diseases, high blood pressure, physical inactivity, obesity, raised cholesterol, hyperlipidemia, decreased vegetable and fruit intake, raised blood glucose, means symptom of pre-diabetes or diabetes, more alcohol and tobacco intake. They are the risk factors for inducing non-communicable diseases, okay? And cardiovascular disease, CVD, diabetes mellitus, chronic obstructive pulmonary disease, COPD, and cancer. The 4 things are very prominent NCDs, and in your patient of palliative care, you will find one of them might be there. So now it is a very late stage, so prevention is no issue. Only the management is the issue, so that the effect can be managed. This is a slide I am showing, a global epidemic of NCD. NCD causes 36 million deaths, 60% of the global death. This is a 2008, and now I don't know what is the data. It must be changed now. 80% of these occurs in developing countries. You know, the GDP defines the country is a lower middle income, low income country, or upper middle income country, or high income country. So low income country is having more, you can see 6.8 million, and lower middle income having 10 million death because of the other deaths from NCD. Injuries, this is the injury, other death, this is the premature, 3.7, 3.3. This is the highest, you can see, and this is the lowest in the developed countries, and this is the 3.7 is the premature death from NCD below the age of 60, which are preventable. So prevention is better than cure, applies very well in the low income countries. I think India also come in the low or the lower middle income. And so in our country, and this is very important factor, alarming factor, and we should take care of it. So this is the death in millions they have given. So metabolic syndrome and prevention strategy. Metabolic syndrome, I have already told you in the beginning, it is all the same thing. And lifestyle changes. What are the changes? Regular exercise for at least 30 minutes, weight management, even losing 7% of the original weight can improve the insulin resistance, I mean the diabetic, pre-diabetic condition, and high blood pressure. So healthy diet, whole grain, lean protein, fruits and vegetables are recommended for your management, and restricting from sugar sweetened beverages, alcohol, high salt and unhealthy fat. Unhealthy fat means trans fats or deep fried products which you are frying the oil, and oil is getting oxidized. If you are frying repeatedly the same oil for a long time, there is oxidation, the air is oxidizing. So peroxides are formed, lipid peroxides are formed. Oil is a lipid, there is a double bond, it gets oxidized. And lipid peroxides you are eating with your food, in the deep fried food, it is very harmful. That's why in your house, when you are deep frying, you are using a very little oil for one time or 2 times. Then the oil is finished. But if you go to the shop where there's a commercial food shop, they are using the oil from morning till evening, and that oil is being warmed. That lipid peroxides are produced. That's why we say this is not good for health. Smoking season, smoking and alcohol, everybody knows, is a cause of the cancer. We have to stop it. And what Ayurveda says, Ayurveda promotes long-term health through dietary intervention and diverse treatment modalities. I told you, treatment, there are 3 methods of treatment: Deva Vyapashraya, Sattva Vajaya, and Yukti Vyapashraya. And dietary interventions, I do food, compatible food with your body constitution. These 2 things are very important in Ayurveda. It's unique, this is a USP of Ayurveda. And if you are consulting an Ayurvedic physician for the management of your patient under palliative care, definitely you are going to give better health quality, which is the objective of palliative care. So remember, you are being a volunteer or a bridge between Ayurvedic doctor and your patient. You have to create a confidence in your patient. Look, if you are going to the Ayurvedic treatment, along with the main line of treatment, your quality of life will improve. And once he is convinced, then call the doctor. Then don't call the doctor in the beginning. Call the doctor when your patient is receptive to him. Patient is ready to take the treatment. So diverse healing practices, use of plants, minerals, and animal products for the treatment, and the use of panchakarma for detoxification, psychological counseling, and spiritual therapy for his body-mind balance. Rich tradition. Ayurveda is a thousands of years old system and is still effective. That's why it is existing. Its existence itself shows that it has a therapeutic response and it has a scientific value. What is science? Science means which is reproducible. If the Ayurvedic treatment is reproducible, it is giving effect. That's why the people are using it for a long time, for thousands of years. And then we are not able to define the mechanism of action. The science is lacking. But we cannot say that it is not scientific. It is scientific. But how to explain the mechanism, that is a $1 million question, and for which the best laboratories of the world are working on it. And I think day by day, things are coming up that look, what was written in Ayurveda is a true science. And medicinal plants use 7,000 plants out of 20,000 known medicinal plants are used by the traditional healers. And out of 7,000, about 100 or 150 medicinal plants are rampantly used by the Ayurvedic physician. So it is the duty of the society as well as the policy makers to grow these medicinal plants, because Ayurveda is dependent on nature. Nature means plants. If you are not growing the plants, they will vanish, they will disappear. So once we know the importance of Ayurveda, we should know the importance of medicinal plants. And for that, we should start cultivating or protecting these plants. Some are herb, shrub, and trees. There are 3 groups of plants. Herbs can be grown in your garden. You start growing in your garden and you start using it. This is the cheapest way of your homemade remedies for all the chronic diseases and for improving the quality of life. Shrubs are also there. They can be grown in the, if you have your farm or the big kitchen garden, you can grow it as a fence. Trees is difficult to grow, but it is the government under the social forestry, the plants or the trees can be grown. So it's very important message for all of you. Wherever you are, try to motivate the families, motivate the policymakers to grow the medicinal plants. Now I am coming to the main point, gut microbiome and its function. The gut microbiome is the community of trillions of bacteria, fungi, and viruses. Key functions: aids digestion and nutrient absorption, regulates immune system, which is very important for your disease management, influence the mental health. All the cognitive disorders are managed by gut microbiome, and metabolism and inflammation control. Now, link between gut microbiome and NCD. Dysbiosis means, this is the medical term, imbalance of gut bacteria is called dysbiosis, contributes to obesity and diabetes, heart disease, cancer, and neurology. What is the science behind it? There are 2 mechanisms. One, the microRNA are produced by this gut bacteria. These microRNA, they cross the intestinal membrane and go to the blood circulation. And through that, they go to the different tissues and affect the expression of DNA. Expression of DNA for the receptors, for the hormones, everything is affected. So, why you are saying the fatty liver is connected to your gut microbiome? Why? Because the microRNAs are entering into your body and affecting the gene expression. This is called the epigenetic method of gene management. Second thing, bad bacteria produce lipids, lipoperoxides, LPS. LPS are the inflammatory molecules. They enter into the body and they create the inflammation. So bad bacteria are producing LPS, which is entering into your system, which should not enter, but it enters, and enters to produce inflammation. And the other thing is the microRNAs. They are also affecting your normal physiology. So because of that, all these diseases are manifested. Strategies to improve gut: balanced diet, number one; regular exercise, number two; stress management, mental, same thing. Ahar, Nidra and Brahmacharya, diet, sleep and physical activity. All the three things have been covered in this. And avoid unnecessary antibiotics and ultra-processed food. This is also important if you want to maintain the gut health. And diet and gut microbiome. There are the terms: food that promote a healthy gut is the prebiotics like garlic, onion, banana, whole grains; probiotic like yogurt, kefir, fermented food. Prebiotic means those substances which improve the quality of bacteria present in your intestine. And probiotic means the bacteria itself you are eating, the good bacteria, like lactobacillus in the yogurt. This is the healthy bacteria you are eating by your orally. It is also affecting your gut microbiome. So prebiotic means substances which improve the biome of your gut, and probiotic means directly you are taking good bacteria. And fiber-rich food, fruits, vegetables and legumes, they are the prebiotic. They comes under prebiotic. They are helping the gut microbiome. Food that harm the gut health, processed food and refined sugar, promote the harmful bacteria. Harmful bacteria means that produces LPS, that produces inflammation, that produces microRNA, which are inhibiting the synthesis of hormones. And excess antibiotics, they are the should be avoided. Understanding the gut immune system. I told you the immune system is the backbone of your body to protect yourself from the infection and from the metabolic disease. Both. Immune system is a one word. We always talk of immunity means bacteria, antibody. But in the Ayurveda we say it Vyadhi Chamatva. Vyadhi means disease, Chamatva means protecting your body against the disease. The capacity of your body to protect the disease. The disease is classified into two: communicable and non-communicable. So in both the conditions, this gut microbiome is helpful. So potential for therapeutic strategy, insight into these mechanisms can aid in developing targeted therapies to enhance the chemotherapy effectiveness. Chemotherapy is effective by itself, but its therapeutic response will be better if the gut immune system is strong by modeling the gut microbiome. Its insight highlights how gut microbiota directly or indirectly influence immune system, providing a comprehensive understanding of their role in chemotherapy outcome. Outcome means the therapeutic response of your chemotherapy or radiotherapy, whatever. Holistic health perspective, emphasizing the importance of gut health and can encourage a holistic approach to cancer treatment and general well-being, quality of life, recognizing the significant role of diet and microbiota in immune regulation. So gut microbiota, I have told you the gut microbiome more than 13 million and they are grouped: firmicutes, bacteroids, actinobacteria, proteobacteria and virobacteria. There are good bacteria and bad bacteria, both are given over here. And impact in cancer because initiation and propagation, diagnosis and treatment. In all the three aspects, this microbiome play an important role. Microbial, metabolites and cancer. These are the metabolites which are produced by this microbiome and they may be carcinogenic to your body. So you have to prevent the progress of bad bacteria because those bacteria will produce these metabolites in your intestine and these metabolites will enter into your blood and produce the carcinogenic property. So be careful. Regulation of cancer-related inflammation. And cancer is a non-communicable disease which produces systemic inflammation in your body, and inflammation produces many diseases. So what you have to do, nip in the bud. Don't allow inflammation to be in your body, and for that, don't allow bad bacteria to grow in your intestine, and for that, adopt good lifestyle and good food habits. You understand the link? Why these NCDs are produced in your body? Because your ahar, nidra and brahmacharya is disturbed. The gut microbiota in cancer management, as I told you, the role of the gut microbiota, understanding the gut bacterial ecosystem, microbial influence on therapy, as I told you in earlier slide, and holistic health care. So these are the microbial changes. The chemotherapy reduces healthy bacteria like bifidobacteria. These are the good bacteria, and these are the bad bacteria, firmicutes, E. coli, streptococcus. So chemotherapy increases the bad bacteria and suppresses the good bacteria. That's why you have to take the prebiotic and probiotic with a supplement. And a cyclophosphamide, this is also anti-cancer drug, decreases the good bacteria and increases the bad bacteria. So this is the thing I want to focus. This is the cytone I have made. This is the chemotherapy. This is the gut microbiome has been disturbed. So this is all these cytokines, natural killer cells, macrophages, beta cells, all affected. TNF alpha producing IL-1, T cells. What I mean to say that when the chemotherapy is going on, gut microbiota is disturbed. So we have to focus lifestyle and food that affects the enhancement of good bacteria, that affect the reduction of bad bacteria. Medicinal plant that help, medicinal plants are having phytochemicals, bioactive compounds. There are polyphenols, flavonoids, alkaloids, tannins, and saponins. They are the groups of organic compounds which are acting as a bioactive compound. They are having antimicrobial activity, anti-inflammatory activity, prebiotic, and antioxidant. All these properties are present in the secondary metabolites of the plant. They are protecting your body. The interaction with gut microbiota suppresses the harmful bacteria, I told you, promotes the beneficial bacteria, and enhances the immune modulation. Now, lifestyle health. How lifestyle health? Balanced diet, rich in fiber, fruits, vegetables, and whole grains. Includes fermented foods like yogurt, kefir, kimchi, or your South Indian foods, dosa, idli, low in ultra processed and high sugar food. This is the balanced diet. Hydration, adequate water indicates supports. 10 to 12 glass of water should be drunk by everybody for having good health. Digestion and microbiome. Regular physical activity is also very important. Quality of sleep, 7 to 9 hours, depending on your age. In the old age, people don't sleep such long. They sleep 5 to 6 hours. But sound sleep, the quality of sleep, the quantity of sleep is fine, but quality of sleep is very important. Stress management. Chronic stress disrupts the microbiome. If you are under anxiety and depression, your microbiome will be definitely disturbed. And this is a vicious cycle. First, microbiome is disturbed, then you are getting a problem, cognitive imbalance, or this is the first, then you are getting imbalance. So we don't know which egg came first or chicken came first, but cycle is there. And mindfulness yoga, meditation helps in maintaining the gut. Nowadays, mindfulness and yogic exercises are very popular. We have a World Yoga Day also in the month of 21st of June. The whole world emphasizes. And yoga means what? There are 8 branches of yoga. All the 8 branches should be practiced. Then only your mind and body will be in tranquility and the microbiome will be healthy. Antibiotic use should be restricted. Don't take antibiotic all the time. Otherwise, what will happen? Your microbiota will be disturbed. With these words, thank you very much.